Hi there, folks. This is Dr. Ellenburg. Welcome to my medical show here on Fox News Talk, 10:20 a.m. Also find us on 95.5 FM. If questions about your health there, questions about our medical topics, give me a call here at 522-1020. That's 522-1020. And yes, folks, this is a live show. If you've heard the last few, we had to have a couple of recordings. I was gone last week, actually up north doing some hunting, but I'm back with some good information to talk today about your health and some good medical topics. And as always, your questions are welcome. It is a live call-in show. You're encouraged to call if you'd like. And again, our number here is 522-1020. Also find us online at foxnewskoan.com. That's foxnewskoan.com. Listen to us live streaming on the web if you have a hard time or a poor reception wherever you're at this point in time. Okay, well, a few reminders, too. During the week, you'll find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com, and that's drellenburg with a u.com. List of our services, archive radio shows from the past, suggested, that word out there, books to read, and suggested websites as well to learn more about your health at drellenburg.com. And again, a reminder, I do see patients in the Palmer and Kenai areas every month. Please give our office a call at 563-2366 for times and dates. All right, let's get started today. Got a hodgepodge of various topics here today, including discussions on the flu shot, of course. It's that time of the year we're hearing more about. Also talking about cancer as well, talking about melatonin in Cancer Day as well. Using vitamin C to treat a shingles outbreak. And also a very interesting test known as a coronary arterial calcium score that can be done to look at the inside of the arteries of your heart to see if you have any hard calcifications. Before we start today, I want to talk about a brand new, I guess it would be a brand new database, because we're right word to use, from our friends at the Environmental Working Group, or EWG, Environmental Working Group. If you have internet access online, it is ewg.org, ewg.org. And the Environmental Working Group has been around for some time now, and they do a lot of work at trying to look at what in the environment, and again, remember that's anywhere you live these days, even at home or outdoors or at your work, and how can your health be impacted by that. They've done past studies on water analysis. In fact, you can put in your zip code and find your water analysis on this site to see what was in it. You can also find out about things like Teflon, for example, why you don't want to use nonstick pans made of Teflon, for example. And they also have a wonderful database on there that looks at a variety of chemicals and what diseases they have been linked to based on the research evidence that currently exists. And now, they also have a cosmetic database on that site as well, ewg.org. That's the Environmental Working Group. They had a brand new one that just came out looking at EWG's 2012 Guide to Healthy Cleaning Products. So we have hand soaps, we have dish soaps, you have laundry detergents, bathroom supplies, bathroom cleaning products, and what are found in some of these things and how they rate. And they rate them from an A basically to an F. And many companies get Fs for a number of reasons on this particular database, because a lot of things aren't really mandatory as far as being listed on the actual label as to what's in it. That's part of the problem. And the second piece is you find a lot of things that are very hazardous to your health. I mean, no one's saying use these things as an internal on any humans or anything, but they're saying you need to be very leery of what you're using. And if you are a consumer out there who wants to use greener products, you can get on there and actually you can get your product rated and see if it comes up high on the list or low on the list for being a safe product to use in your home. And again, that's EWG's Environmental Working Group site. You'll find our database there called the Guide to Healthy Cleaning. The site's free. Information's free. It's good all around. So check it out. And they have spent some serious time reviewing over 2,000 household cleaning products for toxicity of the chemicals in them and disclosure of what exactly is inside those particular cleaning products. So check it out at ewg.org. All right, again, folks, if you just tuned in today, this is Dr. Michael Ellenburg. It's our medical show here on Fox News Talk, 10:20 a.m., also simulcast on FM at 95.5, and, of course, on the web at foxnewskoan.com. Questions about your health, questions about topics, Give me a call here if you like. The number is 522-1020, 522-1020. Well, in working to find, interesting topics to bring to you folks out there listening to us, I peruse a lot of different databases, and one I use a lot is a very mainstream database called the Medscape. And, I can get email, basically mailings twice a week from Medscape on a variety of topics, from primary care medicine to cancer to respiratory therapy. So it's quite a wide range, and many of you out there would probably never belong to it if you weren't involved in medicine. But nonetheless, it's interesting to see what we can come across. And this one particularly caught my eye yesterday when I was looking at a number of things for today's show, and it was entitled the following. It goes, "It's the presentation, stupid. A patient is not a lab test." And this is a good reminder. Probably about 2 or 3 years ago on the show, I talked here about an article written by Dr. Abram Hoffer. And he was an MD and a PhD whose one of his main missions in life was to bring sanity to the treatment of psychiatric disorders, such as schizophrenia or bipolar disease. And what that meant was he wanted to see, can we really figure out what's wrong with the patient, and demonstrated over his many years of work. He died when he was in his late 90s, that, for example, in schizophrenic patients, many of them actually had food allergies that led to a lot of their actual mental disorder. Not the fact they had schizophrenia, what was causing it for them to act that way. And a lot of them had really terrible food allergies, for example. See, accomplished quite a bit with those sort of patients. But he had an article talking about how medicine moves forward. And the second piece of that article was talking about how we need to really consider, when we see patients as providers, that we don't get caught up in just looking at their lab work. And what I mean by that is, doctors can be very, very busy at times. And in most offices, unlike mine, you might go in and you see your doctor for maybe 10 minutes, 15 minutes if you're lucky, because he or she already has 3 other rooms waiting to see them. In those rooms, they're seeing 4 to 5, maybe even 6 people an hour. Pretty crazy. Kind of hard to practice really good medicine that way. It's more of acute care. What's your current problem right now? Can we focus on that and treat it? Versus what are some chronic disease things taking place in you that need to have more of an in-depth interview and history taking with you. But one area that we do use a lot in medicine, even as a naturopathic doctor, as I am, is lab work. And what can happen a lot of times is that we will rely upon the lab work to give us the presentation of how this patient's come to our office versus their story or their history. And, laboratory tests can be extremely helpful in trying to come up with a diagnosis for our patients. But the clinical picture, that means what are the signs and symptoms that our patients are presenting with, really comes down to being what one might call the most powerful test that we currently have available. And it's asking questions, it's thinking maybe even outside the box with patients. And in this particular article, they talked about a patient that had come in with an infection, or it seemed like an infection. They had strange, chest pains, or even had some strange abdominal pain. And over a period of several different visits to an ER, unfortunately, because they were not figuring out what's wrong with this patient, the patient ended up having lupus, an autoimmune disease, which is more common in men than women, but can occur in men as well. And what I found interesting in this article as well is talking about the types of infections that we don't look for in patients. And, typically if your body has a fever, you're fighting off something. And you might be fighting a bacterial problem. It could be a viral problem. A lot of people who have night sweats, and these are not hot flashes, people who have night sweats typically have an immune challenge taking place. Their body is fighting something. And we frequently see a lot of patients in our practice over the last several years with what's called Epstein-Barr virus, or EBV, which is mono, where they don't have it like a full-blown case of mono where you're laid up in bed for weeks and losing weight and fatigued and tired and fighting this virus, but they have bouts of it where for a period of time they'll be tired for a few weeks of time, and they'll start having night sweats at night, and then they go away for a while, and they come back. And these can also be other things too, but I'm just giving you a picture where we have these chronic infections that need to be addressed or at least treated, and sometimes the symptoms are going to match more of a viral problem where your doctor would never ever consider using an antibiotic which kills bacteria only. They might say, well, rest, fluids, take it easy for a while and see if your body can fight this off. And that's where, as a naturopathic provider, we can look deeper and say, well, let's talk about doing things for your immune system. Can we help your body fight back? and strengthen it and not just be treating symptoms. And yes, you can with a variety of different therapies. And the same thing, again, if we back up and go to this whole point, this article here was talking about it's how a patient presents to our office, not what kind of labs they have specifically. We use lab work to augment how we make decisions. That's how we're supposed to be doing it. And that includes medical doctors, nurse practitioners, the like, all of us. That's how lab work should be used instead of making the final decision a lot of times. And occasionally there are some things that are very clear-cut in laboratory medicine that, the lab's going to make that final decision for us. Yes, this is what this patient has. This is what we're going to do. However, with things that are more chronic, for example, in fatigue in some patients related to hypothyroidism, I talk a lot in the show about low thyroid function, and that's one big group where a lot of times they're presenting lab work. The doctor will say, well, your thyroid's fine, and it's not fine. They have all these symptoms of low thyroid disease, yet the labs don't support that diagnosis. And this is the process of medicine changing as we go along and realizing that one of the best things ever, and Sir William Osler, a very famous British physician from the late 1900s, said, more times than not, a good history, a good investigative questioning of the patient will give you the answer to what's wrong with them. But I think it's worth reminding us of that. And as patients out there, I know most of you listening probably aren't providers at all, but it's a reminder that, at times you may actually have to tell your provider, listen, maybe you're not hearing me what I'm saying to you, and I know my lab work is normal, but something is wrong. And I would encourage you that if it does happen to you, to press a little further and make your provider possibly have to think outside the box a little bit and may think, well, what am I missing here that I haven't asked as far as questions or been thinking about? Because it's important. And remember, when you see any provider, as always, a reminder of any type, you're in charge, you're paying the bill, or if your insurance is paying the bill, you still pay the bill to get there. And don't forget that. And we work for you. You don't work for us, right? So you should be the ones that say, hey, listen, that doesn't make sense. Please explain it to me some more. Why are we actually doing this? And not always being so trusting and over. I know for a lot of doctors don't agree with that statement when I said, but it makes for a happier patient and a happier provider overall, and working together with you to help you out with your health. It's an important part of the process, an important part of the approach in trying to treat people and as a patient to be treated appropriately by your providers. All right, folks. Well, today this is Dr. Michael Ellenburg. Listen to our show here on Fox News, 1020 a.m. Also find us 95.5 FM. And our phone number here at the station is 522-1020. We do encourage phone calls if you have questions about medicine. Our number here again is 522-1020. Again, some reminders, too. I haven't set up yet, but I want to probably start either next month or November. Last year we did some talks and discussions on a variety of topics on medicine at the Organic Oasis located in Spenard here in Anchorage, talking about things like cancer, talking about fatigue, talking about cardiovascular disease. And we'll probably have some of the same topics to go over again because there's always something new to talk about in that arena. And these are always very informative sessions that are encouraged and to stop at any point in the presentation, and people can ask questions about the topics as we go along. And it's kind of fun to do that in a live setting, and it usually lasts a couple of hours, and I'm hoping within the next couple of weeks I'll be here letting you folks know out there listening to the show. We'll be talking again at Organic Oasis. All right. Well, let's move on here. About some more things here today. There's a test that I've mentioned here many times on the show, and there was an article that appeared. Where did it appear? It appeared in the Journal of the American Medical Association, or JAMA, the August edition 2012, talking about a recent study that looked at various cardiovascular disease risk factors or assessments. And as a provider, if we just mentioned about having labs, but if we can have tools, sometimes it gives us a better idea how a patient's cardiovascular disease is doing, or two, if they have risk factors, how can we do something to prevent those risk factors from contributing to causing disease in those patients? And one of those tests that's very interesting, that's been around, I want to say since about the late 90s, is called a calcium score test, also known as a coronary artery calcium score. And what is done with that particular test is that a patient is exposed to a little bit of radiation, ionizing radiation specifically, from a CAT scan. And the CAT scan takes less than about 15 seconds. And what it does is it focuses specifically on your heart and takes basically over 200 pictures, kind of a cross-section of your heart, looking for hard plaques, calcified plaques inside the arteries of your heart. And based on certain mathematical scales, they can come up with a number to say your number based on looking at your arteries in your heart is the following. And you usually want to be somewhere under 300 or 400, and you want to see basically a 0. The one drawback also of this test, besides the fact of being exposed to radiation, is the fact that it will not show you soft plaque formation in the coronary arteries of the heart. It won't show you the hard plaques. However, it can give you a very good idea, as far as the screening for patients, and I use it more for that than anything else. And you can get them in a variety of places here in Anchorage, and I believe you can now probably get some down in the Kenai area as well. And the test does not tend to be paid for by insurance, and therefore it typically tends to be priced under around $200, probably less than that. It used to be $100. I believe it's got up a bit to $150. So still a very inexpensive test that can show you a lot about your heart and about the surrounding area of your lungs, and see how they're doing as well. But it's called a calcium score test. If you're the tests that were in this article, and we're comparing them to other ways of looking at coronary artery disease. One was measuring your blood pressure and your ankle versus your blood pressure in your arm. That's an index. The other one was the calcium score test we just talked about. Another way of doing that was looking at your carotid arteries. Those are very big arteries on both sides of your neck that you can do a ultrasound on and look for narrowing or stenosis in them. We can also, of course, look at your family history. And one specific lab test used in this study was called high sensitivity C-reactive protein. And CRP is a measure of inflammation in the body, and the high sensitivity marker, C-reactive protein, may indicate cardiovascular disease if it's elevated. But out of all these things I just mentioned as far as testing, one that tested the best out in this particular study in JAMA here last month was the coronary arterial calcium score. And again, as I mentioned, it's a great way of looking inside your heart. One of the caveats that they talk about in this particular article is the benefit to society and I'll quote it directly, there will be no benefit to society if we drastically reduce the number of heart attacks only to find out that everybody is developing cancer. Meaning what he's talking about, if we're using imaging techniques that look inside your body that use radiation, we could be increasing risk of developing cancer. The problem we have these days is that CAT scans for the last several years, to some extent, are almost being overused. It's a phenomenal technology, but it has exposed people to ionizing radiation, and we know that ionizing radiation causes cancer. And when you're exposed to radiation of any type, it's cumulative over your entire life. It doesn't just go away after a period of time. It's in you for a very long time, way well past the time you're probably, well, for sure it is after you're dead, assuming you weren't cremated, but you've been buried directly. So the point being is that you can be exposed to radiation through a variety of medical imaging studies that may increase your risk of cancer. And of course, as we know, cancer risk is quite elevated these days from where it was many years ago, and you don't want to increase that risk. So the benefit comes to be how much radiation are you exposed to from a calcium score test. It's a small amount, and I think in certain circumstances with certain patient populations and their family history and other risk factors taken into consideration, that the calcium score test is worth looking into. So that's the piece on that I wanted to talk about again. I think it's a very beneficial study that can be done. Everybody in my family has had this, not everybody in my family, but my older family has had this test done to look at calcium score levels, and helps the provider make a better idea, what are we going to do as far as treatment of this patient, or should we be overly concerned about where they're at if they come up with a 0? If your score is a 0, I don't recommend doing one almost ever again. They don't tend to typically go down a whole lot, even with a whole lot of therapy. Patients out there are also using these days chelation therapy or IV therapies that might include that, and that tends to improve circulation throughout your body, but not necessarily by pulling out the plaques, these hard plaques that exist in the form of calcium deposits inside your arteries. We're not really sure how it works. Like many things in medicine, as a matter of fact, we're not sure how they work, but they do and can. But a calcium score test might help you decide, what sort of action should I be taking to further decrease my cardiovascular risk, or if I have cardiovascular disease, should I be getting more on the ball and trying to improve my health? And of course, improving your health is always the name of the game, folks, right? Because the more we can prevent, the better off you're going to be long term. Costs you less, costs your insurance company less, and you live longer, right? There's the added benefit right there. Preventive maintenance, a very key piece, right? And I always make a comment about this, and it's a fact. We actually spend more money typically on our cars for preventive maintenance than we do on our own bodies. And your body needs preventive maintenance too, not just when something happens, now we'll take care of it, right? That can almost be too late at times when it actually happens to do that. Okay, well, we got about 3 minutes before the bottom of the hour here. If you have any questions about your health, the number here is 522-1020. It's 522-1020. And while we wait for the calls here, I will go into a little short piece here that I found on naturalnews.com. Check them out sometime. Very interesting articles that post there, usually once or twice a week. Even belong, if you want, to their email newsletter. It's free. And a variety of things on topics. But there's an article written by Dr. Keith Nemec, is Nemec. And he goes in, his title article is The Only Way to Completely Heal Breast Cancer. And he goes into a variety of different discussions. But one area that we can open up this for a short piece and talk about again is whenever we are diagnosed with cancer, any of us out there, it's important to really be looking at our life, right? Our worries, our fears, our angers, our irritations in our lives, and trying to change those to the better. Instead of just dealing with those things and taking it all in or just put it on your shoulders and walking around with it, you want to get it off of you because it's this mental and emotional stress that does not contribute at all to your overall physical health in the first place. In fact, it can cause disease. Very often it does. And as I mentioned before on the show many times, that one of the last things we talk about with our patients who see us who have cancer from their first visit to see us is we go over or try and get them to open up a bit. What kind of stress, other than the fact you've been diagnosed with cancer, which is a giant stress, right? It's the first one, but beyond that, what else are you doing within your life? Are you happy in your marriage? Are you happy in your partnership? Are your children that you're happy with or angry with that are stressing you out? Do you like your job? Do you hate your job? What do you do for fun? What are you doing to take care of yourself versus everybody else? And a lot of times the cancer patients, they tend to be kind of folks too that are doing more for many others and not doing a lot for themselves. Because they're focused on taking care of everybody else and not taking care of themselves. And it happens to a lot of us, even without cancer. We spend a lot of time focusing on, bills to pay, taking care of the house, taking care of, a parent, whatever it might be. And we tend to forget about, well, how are we doing inside? How is our health directly? And it's a huge piece, not just for cancer. It's a huge piece in any type of disease state you're dealing with. And it's a huge piece just staying healthy in your life. And one can argue, well, there's a healthy amount of stress you can have. Well, there is that. That can motivate people at times, but a lot of times it weighs people down as they take on more and more burdens of a variety of types. And we must definitely think about it. If we're ever diagnosed with any type of disease, including cancer, it's important to consider, how am I running my life? What kind of stresses are involved in a variety of places? And how do I rid myself of those, right? That's very, very important. Well, there's a sound, folks. We're going to our break here in the next 5 minutes. We'll be back shortly. Stay tuned.
Looking out for love in the night so still. Oh, how build you a kingdom in that house on the hill. Looking out for love. I'm your only friend. I'm not your only friend, but I'm a little glowing friend. But really, I'm not actually your friend, but I am.
Hi there, folks. This is Dr. Ellenburg. Welcome back to our medical show here on Fox News Talk, 1020 AM, 95.5 FM as well. Simulcast. Also find us online at foxnewskoan.com. That's foxnewskoan.com. Check us out. Questions, comments about your health today? Our number here at station, of course, is 522-1020. That's 522-1020. Well, it's that time of the year to talk about one of my favorite topics, and that is the flu vaccine. The flu vaccine, yes. To get the flu vaccine or not get the flu vaccine, that is the question. And as many of you know, if you've been avid listeners for a while here on the show, I am not a proponent of the flu vaccine. And we'll have to have a show here in the near future for those who are saying, well, this guy's crazy, where's he getting these things from, that talk about what are some actual stats that demonstrate the flu vaccine doesn't do a whole lot. Well, first of all, it's important to understand the flu vaccine is composed of 3 different viruses that caused the flu at the previous year. And those are put together, and we use them this year. And basically the suggestion is if you get the flu shot, if you get the flu, maybe it won't be as severe, okay? First of all, viruses mutate and change. The same flu that happened last year is not going to happen this year. It was some variant of that particular type of virus, okay? This is biology. This is science we're talking about here. We're one of the few countries in the world that actually does a flu vaccine. Why do we do it still? Because it makes people money. Okay, yes, and other stories of I've had patients saying, well, I always get the flu shot because when I do, I never get the flu, ever. Well, great. Well, I've had the flu shot since age 16, and I never get the flu either, okay? So the first piece is the flu vaccine. The second piece of the flu vaccine is they still use thimerosal in the flu vaccine. That's ethyl mercury, 50% ethyl mercury as a matter of fact. Why is it there? It's so foreign to the body that when you get injected with the flu vaccine, the body recognizes it immediately because it's mercury that's not supposed to be inside you in the first place. Ethyl mercury, also known as thimerosal. This is true stuff, not making it up, okay? It's also there in that vaccine because it preserves the viruses so they can make it in India, okay? But those are some of the biggest things with that. And there have been several studies that have demonstrated if you get the flu shot, your chances of getting the flu are the same if you didn't get the flu shot. And there have been no long-term data studies done over the years. And some of the best information came out of a French scientist here a few years ago who went over all the data that currently existed because he was investigating the bird flu pandemic that didn't really turn into a pandemic and demonstrating that there's no evidence to demonstrate the effectiveness of the flu vaccine in the first place. Yet we just keep doing it over and over again. So one of the main points, we call it online, don't hold them up. Mike, are you there?
Yeah, I'm here.
Hello there.
Work. So I had a couple instances of, I don't know how to say it, hematuria or something, blood in the urine.
Okay, yep.
And so I get a couple CT scans, $5,600 worth,
Oof.
and they stained it or tinted it with iodine. And they tell me it looks like I have some kidney stones, but they're really small and they're in the kidney. And so I start researching this stuff, and I'm reading that I shouldn't be eating dark chocolate, and I shouldn't be drinking green tea, and something about oxalates. And I wonder if you could explain what that means, and I'll just listen off the air since I'm working.
Sure. Okay. Thanks for the call, Mike. So it's important to talk about some of the main types of kidney stones that we see commonly in patients. So there's different types. One of the most common types are called calcium oxalate stones. You then have what's called uric acid stones. And there's a third one, category called struvite stones. I think there's a fourth one, too. They're pretty rare. That one on top of my head, I'm not remembering. But the main ones being calcium oxalate kidney stones and being uric acid kidney stones. Now, it's interesting in Mike's comment there on suggesting don't drink green tea, maybe because it may have high oxalate activity. I've not heard that one before. Chocolate one I have heard before. But a lot of times, which you might hear from providers and those who get kidney stones, is that, well, there's nothing you can do about it. Well, there is something you can do about it. In fact, there are calcium oxalate-free diets that do exist that are out there. And I've had some feedback from patients who have done those diets over the years and had some major decreases in their occurrences of the calcium oxalate kidney stones. I've also heard them not helping those patients at all. And part of that comes down to a lot of people is do we have good hydration? Extremely important. And your kidneys are filters, okay? They filter all your blood every single day, taking out things you need to stay in your body and get rid of things you don't need and get out of your body, okay? And if you have thicker blood, literally, over a longer period of time, you're going to gum up the filter, okay, and increase your chances of getting a kidney stone. So therefore, hydration is extremely important. And by the time you are actually thirsty, you're already dehydrated. So how much water should you drink? Big debate over the years. I would recommend probably, this idea of the 8 glasses, 8-ounce water a day, which is basically 2 liters, is probably a good number for an adult, not for a child, of course. And if you have more activity and you exercise a lot and sweat a lot, you'll need more water, okay? Now, we have uric acid kidney stones. Uric acid kidney stones are due to the kind of diet we're actually eating. They may be high in red meat, high in a variety of proteins, or even high in the amount of alcohol we drink. And those can increase your risk of developing uric acid kidney stones. Also, the same type of uric acid that can cause gout in people as well. And if you happen to get chronic uric acid kidney stones. One is obviously a major change in diet is going to be needed. Two, maybe you're deficient in vitamin C, because vitamin C actually helps an enzyme, actually inhibit an enzyme called xanthine oxidase in your body. It actually increases uric acid formation, so vitamin C can be very helpful. And it does not cause kidney stones. I know the information is out there on the web. It's not true. You can also work at doing things to make your urine, this is both for calcium oxalate and for uric acid kidney stones, more alkaline. Okay? The pH scale goes from 1 to 14. 1 to 6 is acidic, 7 is neutral, and 8 to 14 is alkaline or basic. Well, first of all, your urine tends to be in the range anywhere from 4 to about 8 on the pH scale. And more times than not, I would say, and we do a fair amount of lab work at our practice in patients, we tend to see pH coming back at typically between 5 to 7, mostly. I may occasionally see an 8, may occasionally see a 4, so pretty much 5 to 7. And you can make your urine more alkaline by eating foods that make you create alkalinity in your body. And some of those foods don't make sense. For example, lemons, apple cider vinegar, even though they're acidic, they actually make an alkaline environment happen in the body. So the biggest one thing is foods. Two, you can consume things that might make you alkaline. I don't recommend patients doing this on a regular basis. However, you can take a small amount of baking soda daily, small meaning like no more than like a teaspoon and a half a day tops, and that can help make you more alkaline, actually help dissolve kidney stones. So if your urine is, and how do you find out if your urine is acidic or alkaline? You can go to the health food store, even a pharmacy would probably have some urine pH test strips. They're cheap. You pee on it, usually in the morning is the best time to do it, and get an idea where your pH is at and where to start from there. So some of the big things there on the kidney stones is, well, one, how do you treat them? One, you can treat it with diet, and you can make yourself more alkaline. Should typically probably help. And thirdly, hydration. And yes, Mike had talked about there saying that he had seen hematuria, he had seen blood in his urine, and through a CAT scan demonstrated some small kidney stones. You know, if they get really big ones in there in your kidneys, how do you get rid of them? Well, one of the techniques that a urologist may use or nephrologist might use, as kidney specialists, is lithotripsy. We'll actually go in there and do a shock wave at your kidneys to break up those stones to get them out. And it can work, and it can also be kind of painful as well. So we tend to be more on the side of things where let's see if we can actually dissolve those stones. If they get too big, they can be very, very hard to dissolve. But if you have very small ones, like Mike mentioned there on his call, one might suggest that increased hydration and getting his urine more alkaline might actually help get those stones to basically, dissolve from where they're at. And it certainly can happen. I've heard patients do this without having to go have a shockwave sent to the kidneys and get rid of these stones and long-term problems. But it's best to check online for an acid alkaline diet. You can buy books on it too, to see what foods make you more acidic. And I will tend to tell you that anything that is a meat of any kind, including fish, tends to make people more acidic. I'm not saying become a vegetarian, but if you're trying to treat a problem like a fairly acidic urine, you want to maybe consider eating a lot of greens and vegetables for a long period of time to get yourself in a much more better alkaline state and try and get those stones dissolved and be hydrating with plenty of water. Okay? So the best ways I can describe to consider in treating kidney stones. So thank you, Mike, for the call. Great question. It's one that we come across very frequently with a lot of patients, and what have they done or tried to change things. And again, we did mention if you do have uric acid kidney stones, that vitamin C might be very helpful for that condition, not for calcium oxalate. And again, you can also find calcium oxalate-free diets online as well, calcium oxalate. And if you have chronic kidney stones and you don't know the type of stones you actually have, find out, because your doctor probably knows. You usually want to get a sample of those and test them to see whether they can recommend what else for you to do so you stop getting chronic kidney stones. All right. Well, in mentioning before the call there, I was discussing the flu vaccine and my reasons for not liking patients to get it in the first place. The main thing being it's based on last year's most prevalent strains of viruses that cause the flu, and those viruses mutate. So not the same ones this year at all. In fact, there will be different ones from last year. There will be just like different strains from last year. And the suggestion being that if you have something even close to it, well, the flu shot will help you not get it. Well, we don't really see that. And again, the data does not support that. And a lot of other industrialized nations do not even use flu shots, folks. Mostly us. Okay. So it's up to you. You can do what you want to do with that. What would I do instead of the flu shot? What do I recommend patients do instead of the flu shot, especially in Alaska? Well, for one, consider getting your levels of vitamin D checked in your blood. There is a fair amount of good data out there. In fact, a study here today you can talk about that how vitamin D, supplementing with vitamin D can cut respiratory infections and also increase your innate, that means your innate immune system, help strengthen it. And so vitamin D, again, based on where you're starting from, and so, we're discussing these days saying that most adults, in Alaska at least, might want to consider taking 2,000 IUs a day of vitamin D. That might even be too low, and most likely is, and most of us here live in Alaska, if you don't take vitamin D already, because we only get vitamin D from the sun for a very short period of time during pretty much the months, middle part of April till about basically right now. The rest of the year, the vitamin D that is made in your skin, which comes from UVB, ultraviolet B rays from the sun, is blocked by the ozone layer. And you don't get any made in your skin. So I recommend some folks consider even suntanning in the winter, maybe once or twice a month to keep good vitamin D levels in their body. But so vitamin D would be great for preventing the flu. Taking extra vitamin C during the winter. Like, for example, if you're taking 1,000 milligrams a day, take 2,000 milligrams a day during the winter. What else could you be doing? You could be taking kelp tablets for your thyroid, which also contain iodine. Iodine is a wonderful antimicrobial against viruses, funguses, and bacteria. Kids could consider taking elderberry syrup. Elderberry syrup has a lot of literature behind it to demonstrate that kids who take that on a regular basis during the winter tend to have less colds and flus in general. So again, something else to be doing for our children, and themselves can also be taking vitamin D as well. Again, if someone's a real small toddler, you can give a small amount of vitamin D, even 300 international units a day would probably be plenty. In fact, the study that appeared this month in the Journal of Pediatrics talked about using vitamin D supplementation to cut down the occurrence of acute respiratory infections in children in Mongolia. And this last winter, what they did is they basically picked a certain number of children and gave them 300 international units a day of vitamin D in milk. The other group got none, and there was quite a difference. Let's see here, what was the difference? First of all, the levels of vitamin D were very low. They were checking out what's called 25-hydroxy vitamin D, levels around 7, which is quite low. And after 3 months of getting a very, very small dose of vitamin D, in my opinion, they had gone up almost to 19 or 20, which is still out of range in the low end, but it had almost tripled in this case. So it actually was effective. And they saw, here was the ratio, they saw about a 50% decrease in acute respiratory infections in the children who were getting vitamin D than those who were not taking the vitamin D. So there are definitely some things to be doing to reduce your risk of developing colds and flus in the winter, and we develop more colds and flus in the winter. Why? Because we spend more time indoors in general, and we're around each other more often and exposed to more germs. So it's important to consider doing more of those things for yourself in the winter. If you frequently get lots of colds in the winter, it's a demonstration there's something amiss in your body. Either you're low in vitamin D, maybe your overall health isn't the best due to dietary or lack of sleep, obviously big factors again. Maybe your stress is outrageous, and that's why you get sick more often in the winter as well. So a lot of things to consider in trying to change our immune system. And, people will say, well, if there's so many things out there that are supposed to help the immune system, why don't I hear about it from my doctor? Why don't they ever talk much about that? Well, because a majority of our providers are trained to use prescription drugs. And there aren't many drugs out there even indicated or made to how can we actually enhance someone's immune system? How can we make their immune system stronger so it'll fight off colds and flus easier, for example? Those things aren't made. Those things come in the form of vitamins, minerals, herbs, for example. They use a variety of different herbs for your immune system. And those things actually work. And it's not a question of your provider not doing the right thing. They just know what to use. And if you can't patent some type of a drug to treat a problem in this country most of the time, you're not going to hear about anything that's going to help. Okay? It's expensive to run a study of any type on vitamin D, on vitamin C, for example, or even on taking things like olive leaf extract, which is great for colds and flus. These things don't make anybody $1 billion. So until that happens, you won't hear much about these sort of things that are out there that you can do for yourself and for your immune system. The biggest thing you can do for yourself and your body is proper rest, hydration, and a good diet, and then low stress. Those 4 right there, away from any type of supplement, of any type of vitamin, will put you in a way better place to fight off some type of disease or some type of a cold or flu you might get in the winter or the summer for that fact. So we'll talk more again about flu in a few months again and see where things are at as far as the overall flu outbreaks this year and how much the numbers are at. But we'll go from here. All right, folks. Again, it's Dr. Michael Ellenburg. If you have questions about your health, number here at the station is 522-1020. It's 522-1020. And you can also find us, of course, at 1020 AM and 95.5 FM and online at foxnewskoan.com. All right, well, we got about 7 minutes left in today's show. Let's go into a few other areas before we run out of time today. And if you have calls, of course, please call me with the questions about your health or about our topics here at 522-1020. A very good article recently appeared talking about melatonin in the Cancer, Chemotherapy, and Pharmacology Journal of May this year. And the article was looking about a variety of trials that have been done looking at people who are receiving standard chemotherapy and or radiation and at the same time receiving melatonin. And why would that be helpful and what's it doing? Well, first of all, where does melatonin come from in the body? Melatonin in your body is made in your pineal gland, in the center of your brain, and is typically secreted at night while you're sleeping. And even in those who work night shifts aren't getting good secretion of melatonin because they're being exposed to light at night when they should be sleeping, which there's been a couple of articles already out over the last several years demonstrating an increased risk of breast cancer in women who work night shift work and then those who do not. So, but what can melatonin do? Well, one thing they've seen overall is it seems to be involved in a couple of different areas of the patient's immune system, and also now talking about even mitigating some of the treatment side effects in relations to patients who are receiving chemotherapy or radiation. So we're getting several, different effects, where before we tell a lot of people to take melatonin if they had cancer because good for your immune system, good to make your immune system stronger. And now we're seeing these different studies that have been out there, and these patients are taking about 20 milligrams a night, which is a pretty good dose. And outcome, what are some of the outcomes from taking that along with when they're getting radiation chemotherapy in general? And that is helping tumors regress, get smaller, increasing overall survival, and even mitigating, again, treatment side effects such as nausea, such as fatigue, and even neurotoxicity of your nerves, depending on the type of chemotherapy drugs that are used. Okay, we'll call her on line one. Dave, are you there?
Yes, I am. Hi. Hey, is there much that can be done with Achilles tendonitis secondary to running? Seems to be, as I've got into my 50s, I can't seem to run anymore without picking up a tendonitis in my Achilles.
Your Achilles?
Yeah.
Obviously, the main stuff, of course, is going to be stretching, and I'm sure you've been doing plenty of that.
Yeah.
You may want to consider some work with Rolfing. Have you ever done any of that kind of work?
Yep.
Okay.
I've heard of it. I've never done it. No.
Yeah, Rolfing, it works more with what's called structural integration. They're not massage therapists. They're trained completely differently, actually. Mm-hmm. And it's been around for over 40 years, and not every Rolfer is created equal, but what they do is they work more than just say, well, if your Achilles tendon is tight and inflamed, what can we do to help with your foot? How can we change how you're walking? And looking at you from a structural point of view and saying, well, maybe this ankle is affecting that hip. So there's quite a bit involved in it. That could be helpful.
Okay.
You could also consider some supplementation with things that are anti-inflammatory besides taking ibuprofen, like, for example, fish oil, turmeric, or curcumin, same thing, which is a great herb for inflammation and other things too, but also very good for inflammation. You consider taking that as well. And then obviously what you want to hear is some type of other type of activity, be it maybe biking or swimming, something that's going to be easier on your body.
Right, yeah, and I'm sort of getting to that point where I'm going to make myself more accepting of that, I guess.
But and then the thing is too, I don't know what surfaces you run on. Is maybe running on more on trails versus pavement.
That's all I run on.
Okay,
trails.
That's good.
Yeah.
Okay,
yeah.
But I would consider some of those things. I really would recommend considering the Rolfing piece because I've had great benefit myself with a variety of problems I've had over the years with musculoskeletal problems that have resolved, and I'm back at what I want to do. So
okay,
check it out.
I'll look in that direction. Thank you.
All right, you're welcome. Thanks for the call. Bye. Chris, anybody else? Oh, Peter. Hello, Peter. Are you there?
Hi.
Hey there.
Yes, I'm here.
Go ahead.
I have a question. I've been on Prilosec for a year and a half, close to 2 years.
Okay.
to make the long story short, I was diagnosed with acid reflux, and I've been taking it, and it seems to me make my life normal.
Okay.
But I know that prolonged use of Prilosec will have some side effects later on.
That's
maybe.
correct. Right. Well, and one of the biggest problems is, Peter, is that it decreases your acid output in your stomach, which will decrease your heartburn.
Yes.
But it also is going to affect how you digest food on the long term.
Okay.
And we tend to see in patients who are on long-term Prilosec, they can end up with the deficiency of B12 and other nutrients. Part of the thing to consider that you may have not been told at the time when you put on this drug is what else. So what do we know at this point in time that can cause heartburn? One, obviously, is diet. That's certainly a possibility, and in a lot of patients it is. Two, you could have what's called a hiatal hernia, where part of your...
I do have a
do you?
hiatal hernia, yes.
Okay, well...
I had a test, and they told me that I have a hernia,
right.
maybe 5-6 years ago.
Yeah, and that's really the big piece right there that's going to keep this being a common problem. I don't know if you're overweight or not, but sometimes...
No, I'm not.
Okay, you're thin.
I'm not overweight.
Okay, good. So, because sometimes if people are overweight, that can cause a hiatal hernia as well. So that takes you off that page. So, how do you fix that? Well, you can have surgery. That's one way of doing it. And there are people out there who do a type of work called visceral manipulation. And you may want to look into that because that could be helpful. And what is done is they work literally on your abdomen to kind of help bring your stomach back into a better position and hopefully take it out of that, because when you get the hiatal hernia, you have part of your stomach slides up against the inside of your esophagus as it passes through your diaphragm. And that can be worked on that way. And that might be helpful. So look up visceral manipulation online, okay?
Okay.
And there's some folks in Anchorage who do that, okay?
All right.
All righty. And we got to get off. We're running out of time here today, Peter, so I have to get off the air here. So thanks for calling in. All right, folks. I'm Dylan. We're going to get off the radio here. We're about out of time. Thanks for your calls today. I really appreciate it. And again, we're here on Mondays from 2 to 3 p.m. And during the week, you can find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. And Peter, if you call our office, we'll tell you who to go see if you want to see somebody for your issues. Okay, folks, thanks for your calls today. Have a great week, and we'll talk to you next Monday.
Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby, and your family.